The 3-day Triple Elimination Summit was officially opened by the Vice President of Uganda, Her Excellency retired Major Jesca Alupo, on behalf of President Museveni at Speke Resort, Munyonyo. The conference is organized under the theme Unifying Actions, Transforming Futures, Achieving Triple Elimination in Africa by 2030. In his message, President Museveni indicated how the epidemics related to HIV, Hepatitis B and Syphilis have continued to pose a significant risk to the newborn baby through mother-to-child transmission. This, he says, is a health burden to the nation and Africa as a whole.
The interconnected epidemics of HIV, syphilis and hepatitis B represent a significant public health burden, particularly through mother-to-child transmission, which continues to place newborns at the risk during pregnancy, childbirth, and breastfeeding. This is because these infections are preventable and we have the knowledge, tools, and experience to act.
Museveni highlighted the achievements Uganda has attained in addressing HIV, hepatitis B, and syphilis infections. He called for unity among the different stakeholders and member states in the fight.
A reduction in new HIV infections from 100,000 in 2004 to 37,000 in 2024. Second, a drop in AIDS-related death from 87,000 to 20,000 in the same period.
He echoed the government's commitment to addressing HIV, hepatitis B and syphilis infections, indicating the need to localize the production of vaccines and medicines.
We must not reverse the gains we have fought so hard to achieve. Let us work together as one continent with one vision, guided by the heads of state, the African Union and Africa CDC, to deliver a healthier, more resilient future. Uganda is honored to take the lead in convening this timely discussion, and therefore, let this be a moment not only of reflection, but of recommitment and action.
The Minister of Health, Dr. Jane Ruth-Acheng, indicated how the African continent and Uganda as a nation still faces high cases of syphilis and hepatitis B, hence calling for integration amidst funding challenges.
Uganda has been at the forefront of triple elimination, having launched this in 2019. The country went on to develop an elimination plan that ran from 2019, 2020 to 2024. Commitment towards the elimination of vertical transmission of HIV, syphilis, and hepatitis B with a dedicated response and normative guidance has been in existence for over 10 years.
Dr. Cheng revealed how the implementation of interventions eliminating vertical transmission of HIV, hepatitis B, and syphilis is a great opportunity for children to start a life free of the infections.
Integration is the way to go, especially in this era of unprecedented funding challenges, where we're already seeing a reduction in funding from development partners, but also as we progressively focus on individuals as drivers of the health agenda. We need to work together to bring the manufacturing of health products, innovations, and research closer to where the disease burden is, and for us to be able to take advantage of economies of scale.
Development partners from across the globe acknowledge Uganda's remarkable achievements through demonstrating a political will that facilitates the triple elimination efforts. These, however, decry the dwindling foreign funding, which present high risks.
Today is an important opportunity to leverage the decades of PEPFAR health investments and successes, especially in preventing mother-to-child transmission, to achieve triple elimination goal that we all want and have focused on in this conference.
African health sector is increasingly challenged by declining external support for essential programs, including those targeting HIV, hepatitis B, and syphilis.
Speaking to Church of Uganda Family TV, Robert Mutumba, Programs Manager for the AIDS Control Program, indicated how the conference is timely in addressing the triple infections.
Conference has come at the right time, where we think that we should be able to leverage the existing resources that we have to fight particularly these three high burden infectious diseases, HIV, syphilis, and hepatitis B.
The conference will conclude on Wednesday this week with a call to address the escalating cases of HIV, hepatitis B, and syphilis. John Baptist Ahumza, Church of Uganda, Family TV News at 8.